Okay, thank you. Well, good afternoon to each and every one of you. I think we're all ready, right? So I'm Leonovsky. I'm the director of research projects at this conference. I'm very proud to mention on behalf of Zoe Robredo Aburto, the president of the Inter-American Conference, and on behalf of our General Secretary, Mr. Álvaro Velarca Hernandez, we welcome you all to this presentation. I thank you for the presence of Ms. Picasso, Ingrid Picasso, and Miguel Ramirez. And of course, we thank all who are following our streaming, our broadcast in this conference remotely or in this auditorium and networks too. You have been following what we've done during the past year. We've been discussing very important forums, very important subjects in different conferences to talk about the excluded groups of society, excluded from Social Security. So that's why we have this proposal in this conference. We've talked about different subjects. I'm very, very proud today to introduce the Observatory for Advances in Universalization of Social Security. We know that universalization of access to Social Security is a common challenge in our region. We've seen this challenge and we've discussed this in our forum and panel throughout the year and in the past time, right? So access to security is a human right, and that having that coverage. It's also part of different international treaties and international instruments. There's a lot to do for its universalization. The Social Security benefits should be created for all the populations. There's two pendings that affect Social Security. First, there's a lack of full coverage or universalization and heterogeneity in access to benefits. According to the data of 2021 that's sourced from the LIO, we estimate that in America, the percentage of the protected population with a security or health regime is like a 60%. Only 64.3% of the people have effective coverage of at least one monetary benefit. For example, only 57.4% of our people have protection when there's a labor incident and professional incidents or health conditions, and 44.1% access benefits of maternity leave, a bit more than half. It's 51%, and 16.4% of our population has coverage due to unemployment. I mean, there's a lot of achievements, yes, and when we progressively incorporate our people, but these efforts have not been enough. In this conference, we think that the paths to continue progressing for universalization of Social Security in America, we need the participation of those excluded groups in societies. These groups are minorities, are immigrants, people that are working as maids in the household, those who work in freelance or outsourcing means in different types of work or modalities, people who work in art and culture, LGBTs, and the rest of the diverse populations that we have. This conference has clear objectives: research, creating the right venues to debate perceptions, and open to international dialogue to strengthen Social Security agencies. We have a proposal. We drive forward the collective construction of programs and policies or initiatives of law that contribute to this objective. This is why today we are happy to introduce a proposal for the launching of the Observatory for Advances in Universalization of Social Security in America. This is a part of the unit that I direct I'm the executive director of the research projects that depend on the general secretary of this conference. The Observatory for Advances will enable us to understand the coverage and in the continent. And on the other side, we can provide hard data, valuable data in each area that we have studied and have lagged on. This is a tool that will lead us to be capable of creating public policies and programs that are successful, incorporating different sectors to it, which are not under the protection. So we know that this tool will drive forward the creation of a tool of knowledge. We have to align ourselves to best practices, the output of the observatory. The outputs lead us to debate in an informed position and cooperate amongst sister agencies and other bodies along with this conference. Without further ado, we're going to continue with this process. I'm the moderator, Vanessa Storer, so the rest of the panelists will continue. Their floor is theirs. I'm the moderator. Once again, thank you very much. Thank you for being linked to this event. We invite you always to continue analyzing the outputs of this conference and today's program and panel. Thank you. So as a moderator in this case, I can tell you that we have an hour and 15 minutes for this presentation or this panel. We might cut a bit of the time because we have a tight schedule, a tight program or agenda. To begin with, I'll introduce the panel members. They're going to be presenting the outputs of the observatory, and we have other information to provide during this work week. We're going to have a Q&A session at some point, and we're going to wait for 20 minutes. And we're going to expect final comments, the final arguments, and we're going to give closure to the session at some point. Pardon, 1 second. Let me introduce my panel members now. Hold on, please. Okay, pardon. Here we have Ms. Ingrid Picardo Cerda. She's in charge, she's the manager of implementation of the DEPI. She has a degree in social activities in UAM and Iztapalapa and other accreditations with the Mora Institute. She was in an internship in the project at Colombia with socioeconomic credits and the research center to develop the area of economy. She has different accreditations of law from National Autonomous University. She's been a researcher in rural zones, analyzed immigration, cultural issues, customary issues, indigenous populations, anthropology, cooperation, international cooperation for development, social development, and she's into peace building. She has focused on assessing programs and development plans in Mexico, Colombia, and Bolivia. She's worked also in NGOs that fight for the improvement of public policies in Mexico and Colombia. She's been a professor of different credits of management in the master's degree with OCDE in the Mora Institute. She has a lot of interest in fostering open science and social research. Miguel Angel Ramirez is the director of different projects in the division of DEPI in this Inter-American Conference. He has a degree in public policies. He has different degrees from the Metropolitan University in Xochimilco, political sciences from Colmex. He has an accreditation in teaching in Mexico. He's also the director of specific projects of the Inter-American Conference of Social Security. He was also appointed as a researcher of public policies, part of that same unit. He's been into consultation, researching social policies to assess with a board of the federal district or Mexico City. He has published different books and journals of Social Security and its content in Latin America. And he's also has experience as a consultant and has shared his information as part of public opinion too. Thank you very much. Well, thank you very much for your kind intro. You know, the fact is that we're thrilled with the proposal of the project that we are discussing. This project was sourced because of the interest of our General Secretary, and we have materialized this project in the proposal that we're submitting today. I'll share the first slide, and I'll go through it pretty fast. Vanessa Storer already mentioned that Social Security is a human right acknowledged from 1948. We have other international treaties, conventions, or instruments that make it mandatory for the states or governments to guarantee that universal coverage for the citizenship or population without excluding anyone due to age, gender, economic conditions, labor conditions, abilities or disabilities, residence, migration status, or citizenship. However, we've mentioned that there's a lot to do still in our continent. Only 64.3% of people in our population in this hemisphere receive a benefit from Social Security agencies, or healthcare services are a bit more scarce. There's greater gaps. There's gaps to narrow in the Social Security system. Another element to consider is that the exclusion is not the same for everyone, for every party. Reality is that there's different factors, socioeconomic factors, cultural elements even, that are deterministic, and the probability or likelihood of having people benefit from Social Security is clearly there, affected by these elements. Throughout the years in which our Social Security systems have developed, we know that there's vulnerable groups that are in particular finding limitations to have access to Social Security in general, and this is why it's important for us to know these specific groups, their minorities, the characterization of it, the limitations that they face, and we need to design public policy and draft public policy that try to align and correct that diagnosis. Now, next slide, please. Well, why did you want to drive forward this observatory? Our secretary allocated this task on us. Now, and narrowing things down, we'll say that the Observatory of Social Sciences help us examine and watch over carefully the evolution of different areas of interest and generate collective data or knowledge, and we compile it to build specific objective data for public debate, for matters to be lobbied that objectively lead us to draft public policies. This Inter-American Conference on Social Security has a task. Its mandate is to generate areas for thought and research open to dialogue and international level. And this conference has a mandate to collectively build programs and draft public policy projects to guarantee the right to access to Social Security of the America and its populations. Now, having this whole frame and the background knowledge of what frames us here, we speak of the general terms and continue the development of the observatory regarding the advances in the universalization of Social Security. And I would like to mention that, as it's been mentioned before me, the work of the observatory is guided to analyze population subgroups that face limitations or exclusion. This worries us, and there's interest in this subject, and we've analyzed this in the conference for many years. I know that there's a lot of information in that slide. Sorry if you can't read it, but the data there, is seen. You see that this conference since 1942, since the first session that was celebrated 80 years ago, we passed resolutions that called the economies and institutions to guarantee Social Security. We called in people to solve problems with Social Security for those who are peasants that work at the household. We try to give Social Security to those who are working in outsourcing or freelance. Throughout the years, we confirmed or strengthened these commitments to broaden the coverage of Social Security into these vulnerable groups. And you can see it there. We passed resolutions or sentences in 42, 41, 57, 51, 60, 64, 68, 71, 74, 77. So it seems, you see the timeline, it sounds like a list of things to do, right? But I have clarity there. This interest is not new for this conference. We're revitalizing it. We're going back to the origin, to the essence. And that's the tone of this conference or panel in the observatory. We're going to be focusing on analyzing these groups of the population. If we focus on studying them, we can build a strategy that's efficient to achieve that universalization of Social Security in America. So I'm going to limit myself today. I'm going to just share this information as a preamble, and Ingrid, my colleague at the panel, Ms. Picasso, will continue talking about the structure of this observatory, because Ingrid Picasso has been directly involved leading the formulation of the proposal of this initiative or project. So the word is hers. The floor is yours, ma'am, for you to continue the expo. Thank you, Miguel. Thank you. I will take the opportunity now to thank Fanny, because she's been part of this whole process or development. The population that would be benefited by what we've observed in this project of observatory, I mean, we've considered all the members, we've invited the scholars, public in general, people who have an interest in public security. Now, we want the indirect beneficiaries of subjects are those who have the right of the benefits, and there's other guests who are members and benefited. There's people that have no interest in Social Security, but we believe that there would be nobody affected by a project of this nature, right? So the objective that we have specifically in this observatory is to generate information, solid, objective, timely information that serves us to give guidance to draft public policies and projects for the universalization of Social Security in America. Well, we have repeated this many times. We know that our populations have historically excluded. We spoke about those minorities. In this observatory, it's a living project. It's these populations which are being observed are enunciated. There's no limit in the future if we detect further needs to open lines of investigation, to analyze the demographics or the population, to be thorough and under scrutiny analyze our populations there. It's all feasible there. We want to pay special attention to the incorporation of new benefits to the Social Security benefits or services in the region, for example. In this Inter-American Conference on Social Security, we've worked a lot with different researchers. We've analyzed the care, labor and care, the incorporation of national care systems here. We've included them in the matrix of elements that constitute Social Security. We can also layer the incorporation of all other themes such as nutrition. The structure of this observatory is as follows. The observatory has different themes or roundtables per population that are correlated to the populations of our interests that you already know of. We've incorporated in this observatory a cross-crop analysis of public policy, especially in the diagnostic info that we've observed in this observation has been object of, these are the outputs. We have an assessment. We don't implement, we study, we research, but we can be observers amidst the process of implementation and design of things. And well, there's 7 elements or 7 constituent elements here. This observatory, as I've said, has 7 elements. It's alive. We can modify this list depending on the needs that we can pinpoint in this conference, or from whichever point you as our memberships can include here. You can do that. We call it systematization of best practices towards universalization of Social Security. This component or first element is about brief research, and in our findings we have a set of researchers that have been kicked off in which we've been capable of published and compiled data that are called experiences of Social Security. For this series of instruments, there's participation of different stakeholders and public policy on different fields of expertise. We have written, drafted, and called in the experts to create these instruments with public policies. We have continued organizing all the processes. We have worked with unions and other groups of interests or stakeholders that are not consolidated as unions, but we believe are important to observe or watch over, because these other groups or stakeholders do have an influence on the drafting of public policies in place. Now, this project, from its design to its implementation, has to objectively achieve and share its compiled data in the observatory. We want to distribute best practices, lessons learned in cases that we've observed in this continent for our members to cooperate internationally and generate partnerships to inspire ourselves and achieve success in projects with a specific context. In our area or in our department, we have the Technical Assistance Department that fosters the creation of technical support mechanisms that lead us to share knowledge amongst our members. The final product or the deliverable are published every 6 months. We have a case study that's selected and it's of public domain after 6 months. The other elements have been mentioned as technical notes they're part of the observatory. They're short publications that are in which we deal with specific subjects of interest that correlate to the observatory's mandates. When we analyze each group of interest of the observation, we want to be thorough and analyze specific debates and subjects, being punctual to contribute and provide the right feedback to go through a decision-making process in politically drafted laws there. Then we draft them. There's a series of booklets that we publish with certain frequency. We want to publish at least one of these works yearly. The third component is research. The research is data or instruments that we publish with scientific data that lead us to diagnosis of the society's mesh to follow up and draft public policies. As part of our investigations or vetting, we want to have in the face of vetting field work, observations, or monitoring. Amidst the pandemic, that has been a bit more complex, but we always, as interviewer, interview the stakeholders involved, and that seems of great importance for us. We want to identify the barriers, and many times this identification leads us to use qualitative qualitative, quantitative methods, or mixed hybrid methods, depending on the research, the specific research that leads us to deterministic action. We want to study and analyze thoroughly the characteristics and elements that build the barriers that exclude groups of interest. I mean to say, sometimes we have identified what hinders, what obstructs, but we have to understand what it's underneath. How were these barriers or obstructions configured or constructed there? And how can we modify what obstructs to decline or to break down walls or eliminate those? Well, I mentioned this because there's groups of interest that should be capable of exercising their right of social security access. We want to provide evidence or exhibits for public policies to be drafted as instruments to narrow or eliminate the barriers or walls. We have a series of booklets that are published with certain frequency that's not regular, but however, we publish one of these instruments yearly. The fourth instrument is a document. Technical documents are conceptual documents which are similar to the technical notes, but these are the baseline documents. I mean, this is what substantiates. These are published, and we gather information of public debates, of subjects of social security, of populations that are of interest of this observatory. We're thorough in an analysis, even more so than the technical notes. We have the observatory that reaches universalization. That's why in this observatory, it's important to have the support document with the conceptual data in which we explain what the concept of universalization is, which lead to this finer debates and punctual debates and philosophical debates even, which are very fun. And well, the objective is for us to draft conceptual proposals to guide the research that constitute elements of the observatory project to enable people to have the baseline to read the documented information, which are the products of what we've observed. The published information is a series of booklets, and they're, as I've said, published without a specific date and calendar, and we build them depending on the judgment and whatever we consider necessary to produce this as part of the observatory program. The fifth component is the observatory of news of the populations of interest in broadening the coverage of Social Security as well. For this purpose of observatory, we have an analysis, a critical analysis of news, print, and media for the observatory. The analysis data is going to be for public domain every 15 days with a succinct information in which we specify what happens with the setbacks and advancements towards universalization of Social Security in a continent. Based on the succinct information or instruments in which we recap, we create a monthly report with critical analysis of the literature that we've obtained of documented reference information that's updated. What I mean to say is that we redistribute the news that we consider of interest, but also it seems to us that what's important is that we don't get enough time to read all the news and media and all the massive media. So you have like a specific monthly leaflet or bullet, this instrument where we have a critical analysis, this is succinct, in which we explain what these news or media and print have exposed. So we compile information about the current conditions that the public population of interest have to face to access Social Security. We continue monitoring what's happening with access to benefits. The final output of this component, which is the observation, is to submit every 15 days an instrument and every month data that's uploaded in the website for the observatory. There's going to be a button in which you're going to be capable of finding the data source from this observatory. The sixth element is a beautiful component. The rest of the elements of this observatory is important. We have a matrix of indicators or key indicators which are specific with the population that we've observed, which is of core interest. The matrix of data takes longer to build. It's midterm. I mean, it's a deliverable in midterm. We want a matrix of indicators that lead us to understand what happens with the populations of interest that provides hard data of the observatory's task. For this, we need to create that matrix and have cooperation agreements with other sister agencies, with other government agencies or observatories, because we mapped out all the observatories at a regional scale that focus on Social Security observation. Many observatories have expertise on following up and tracking things at a national scale, but it's very important to create synergy and work with other agencies or bodies in different scales of the nation to analyze the population. And we work with other institutions, as I've said. Later on, we'll invite you to continue participate with us if you have an interest. This allows us collectively to continue building and compiling hard data that you can query, share, and analyze in the observatory. The objective of it is to facilitate our member states, and to the general public the monitoring of the progress and the setbacks of the analysis of excluded segments of the population that don't have benefits or these rights. We want to watch over the universalization of Social Security in America, the final product of this observatory. In the last stage of this observatory, we want to establish and implement at least one project of collaboration yearly. Ideally, once we establish the dynamism in which we'll compile the information and gather fine data, reliable data, which is constantly updated, so we can continue building other agreements or covenants or partnerships to nurturing our information with the indicators to understand the population. The seventh and last component of this observatory is the spread of Social Security. I mean, this is a component that gives us the right opportunity, that opens a window to attract members of the population that have an interest on Social Security and other topics. We have a chapter in our website uploaded, and in that segment of the website, we want to share a set of recommendations of art, photographic studies, and culture. There we have information that correlates to the field of Social Security and to issues such as access or lack of access to Social Security. And now we want to really be closer. We want this to lead us closer to people's everyday life. We built this in their website to see how important Social Security is in our lives. The objective of this is we want to be closer and have our citizenship, interest in citizenship in these fields. We want to generate empathy with artistic expression in this segment of the observatory. This segment raises participation of our people. So it's open. We want our people to participate in the observatory. They can send their recommendations. Our citizens can tell us, okay, I watched this movie. It made me think that for a specific segment of the population, certain data might be of interest. We want our people to share their opinions about the recommendations that we issue. So we generate bilateral dialogue. We want to launch a leaflet of recommendations monthly, and ideally here we have to include opportunities, remote opportunities or cultural opportunities or different activities for different countries. We know that we're a whole conference with different members, and all members are considered, not only one, but these are the 7 components. How are we going to manage and administrate the project? The observatory that analyzes the universalization of Social Security in America and the advances is going to be under the rule of the Secretariat of this conference, and we'll continue working with the Executive Committee, the Executive Board, and the Research Board. We work all together. The Directive Unit, or the Committee, the Steering Committee, the Board, the Executive Board is the one that's working on a day-to-day basis, the management of the observatory, which means that everything absolutely, I mean, the Executive Committee doesn't have to publish everything that we've created here, but they do have to administrate it. We have a yearly work plan that the Steering Committee or the Board will have to analyze, review, and approve. The research team are us as researchers. I mean, we're part of the executive or steering committee or board, and that leads the projects of investigation, and not necessarily all the work that is executed is for the observatory's purposes. But what we've been doing in these lines of investigation could also be published. Another point is that the project obviously is going to be a part of open dialogue, and it correlates to other projects of research with the DEPI, like the Permanent Dialogue of Well-Being for the Americas. With DEPI, we continue working to spread the projects and make the projects of knowledge to people of interest in this observatory. The stakeholders, you are included to this. So we have mapped out the matrix with the stakeholders involved, subjects of interest, counterparts, who has to do what are their duties, what they contribute with, and their constraints or limited actions. But that's the list of, we've mapped them out. We share information, as I've said. we've accessed sources of specific data, and we work in collective. We work together. It's important for us to continue working with the fact. The fact is this observatory is built by all the stakeholders, with this conference, with sister or allied bodies with which we have agreements, and there are allies. This is the observatory, and these entities are alive. We continue building with our treaties or contracts. We invite you to analyze the universalization of social security in the Americas as part of the advances of this observatory. It's a collective effort. We invite all the stakeholders and public in general who follow our streaming and broadcast and in other digital means or webinars. We invite you to continue analyzing this day to day, day after day, with studying the expected results. In the matrix of indicators in which we have data of the demographics or the population, we have information of Social Security, so you can understand the project too. You can send us an email to assistance.technical.ciss.wellbeing.org. And if you send us an email to that connection, to that link, we can give you some support so we can work together. As a person of contact, if you have an interest on specific groups of the population and you require information from us that you'd like to discuss with other institutions that's part of that matrix or board of information, we can do that and connect. Or maybe if in your institutions you have some exhibits or photographic expos, as the ones you have observed here at the Seas, you can also share that in the segment of our website in which we make our events known. Thank you. That's what I've had to say for this my participation in this panel. Thank you for being with us. Thank you, Ingrid. Hello, Miguel. I think what we've done has been a major effort. You've been very succinct. You've recapped, you succinctly explained what we want to achieve with the observatory of the nature, of this nature. There's a lot of work to do, you see, but it's achievable. Thank you so much. And I don't know, before we start the Q&A session, I would just like to comment the following. This observatory, I mean, it doesn't just happen, or it wasn't just built just because. I mean, we've worked so hard on the development of each theme for a long time. I think it was the 26th of May when we had that conference in which we analyzed the houseworkers or household workers or maids. We were going to build this project of observatory to analyze the inclusion of women who work at the household in this Social Security benefits. We follow up on the analysis of who's incorporated or who are the subjects that are part of the analysis of the observatory in all its stages. So we believe that that's how we can achieve the objective or the requirements, but I don't know if somebody has questions, suggestions, feedback. The floor is open for those who are present here. Back there, I think someone's raising their hand. Thank you.
Thank you so much, and congratulations to all the team in charge of this proposal of the observatory. And I just ask you to work inside the observatory because it's incredible. And I can see that your scope is very, very wide. So I have a consultation and also maybe a suggestion that we think among all of us how to incorporate the sector of the society, the civil society organized, because all the part of the articulation with the organizations of the civil society have a lot of information about these specific populations, and at least here in the presentation I didn't see it. The Academy, the Institution of Social Security, which are part of the membership, but I didn't see how the articulation process will be taken into account that, for example, in the case that they just mentioned, in the women that work in the homes, there is also rural work and all the populations that were named. And maybe we will have to think about the way of articulating and to evaluate to participate and the ways that they can do it, because it would be a lot. Thank you so much. I would like to answer this question. Yes, in fact, I think that we needed to make it more explicit. And of course, it's a very valuable suggestion, and I would like to highlight that in good measure, these topics are topics that we have been working with in the division of projects, and particularly the case of the women that work in the household recently with one of our member institutions, which is El Café, in the topic of the work at households, that the Secretary General is Marcelina Buendia, a leader, Marcelina Bautista, another leader, and we also are having approaches with an international federation about the topic. So we are working with this. And likewise, in the topic of platform work, we have had approaches with organizations of civil society that devote themselves to the study and the incidents in these topics, and also working organizations. So maybe we gave it as a fact, and this is part of our daily work, the vinculation with our organizations, but we thank you for your suggestions. It's convenient to see it. So, do I have to stand up? No, as you wish, you are at home. Look, since I saw the topic about the observatory, obviously it's very, very interesting with respect to its content, and not only observatory as something that we put and it's not dynamic. So you are proposing something dynamic and the indicators. So, as an experience in the observatories, the essential part, the coverage, and they're going, as you will say, in certain control populations that we want to visualize. One recommendation: let's divide this in the risks, the different risks with Social Security that they are promoting in different countries. Because sometimes either we go to the pensions and we visualize all the part of pensions, or we go to health and we forget a part that is an interrelationship, the working risks, and also the part that has to do with the evaluation and the kind of disability and the impact of professional disease and the chores, working risks, and the economic benefits, other kind of benefits that are visualized in Social Security. And there's something that we were talking in at 7 a.m. They really made us early rising, and tomorrow is the third one, so we're used to it. There's an element of the way that they manage in the health. We always visualize IMSS and ISTE in terms of the structure of how it's managed, in terms of, and the one that manages the part of health, and that manages the control of prices and medications. And there are other systems that are part of health where there is a delegation of the risk. So here we have to visualize certain indicators. So the category is that you manage your own hospitals, your benefits, the prices of all the coverages, and versus when you give the risk to an administrator of health risks to an element that you do not control in certain way, is the value of the service renderer. So I think that the other element that is key, the part of the medications and the medications to chronic diseases. But a high impact in price and a high frequency, and the cost of the drugs may be low, but the impact at the end is very strong in both senses. So the medications that we have to visualize, and if you want to visualize HIV, cancer, and the different pathologies that obviously they have to manage in a better way the pension, but they're also the ones that can press our system. And let's not say the health attention and the economic pressure and the right to health and other key elements who are able to visualize the coverage of health to the one that has benefits of the contributed regime. So this is another element. There are several as well, but I think that let's not overlook the fact that it has to be dynamic of systematic authorization and the ones that generate information that they put them as part of working programs for the institution, and when the CISS wants of the working calendars of the institutions. Thank you so much. Thank you so much for your observations, and I'd like to the first one, I think that is completely ad hoc, the suggestion of analyzing them per risks. In the DEPI, in the executive direction, we tend to perform the studies and the projects trying to implement and make operational the Agreement 102, but we have to visualize this in the COVID document that we prepared and other initiatives. So I consider that it would be pertinent and useful to do the organization of the information in this way also. And with respect to the other topics, I'm going to go out of this project and talk about other projects that will be present in the sub-region, Mexico and the Latin Caribbean, where another team of the DEPI, Professor Krishna and Noé, will present the Monitor of Social Security for the Americas, where they talk about a lot of topics. For example, in terms of resources of health system, in terms of prevalence of diseases, mortality, working markets, and it's an initiative of information. And it seems to me that maybe we could cover this observation. So the indicators that they are posing in this case, in this particular case of the observatory, goes to the interest populations, for example, the workers at home and the workers of platforms and so forth and so on. We will take into consideration the observations, and in fact, the idea of presenting this here is to be able to construct a collective proposal with the favor of membership. And also for this project of MORSA, we are thinking about another stage where the institutions will be the ones that will give us the indicators. It's a project that has been there for so many years. And there are several initiatives. And, well, it goes back to the 80s, to the resolutions, and there's a constant part of our membership. We are giving great steps, I think, in the correct direction in order to take care of this interest, and we will have the interest of discussing in the sub-region and also when we launch publicly the project. And it's not the presentation. All these are very valuable presentations. You want to add something? Yes. The design of the observatory, we think it's crucial to have the quantity part with the indicators, but that there are many questions of these barriers that are not quantified, and that it's important to know them from the most qualitative part in order to get indicators that will be pertinent for the measurements. in the most qualitative part. And this is an important contribution of the observatory. It has different components, and also the researches, the technical notes, the technical documents in order to give way of this more qualitative part of this barrier. It's like a whole. That's correct. Yes, I second the excellent contribution of Lourdes about the civil social importance. And in the same token, I would like to suggest groups that are organized, that are not conformed, and they have a lot of initiatives of communitary responses. There was example before the emergency monkeypox. I'm in a group of gay men that have sex with men. We are doing a communitary response in order to document the registration. And one of the tasks that they have given me, the medications of the IMSS, and the lysosomal diseases for the low prevalence, the high cost of the medication to take care of are a demand of this group of patients, and they are not covered by the services of Social Security in many cases. And finally, the topic that they talked yesterday with a lot of insistence has the diversity of coverage that the different regimes of insurance may have. Okay, thank you so much. Anyone wants to say something? Thank you so much for the observations, and I think that this observation is very pertinent, and we will be looking for some contacts. An important part of this will be to take care of these observations in the research and what we want, and the greater participation of all the actors interested. And also, and if you have ideas, concrete ideas, and if you don't have concrete ideas, or maybe this association, and this could work, we can be working with it. The idea is that they construct working groups for interest populations according to what they see, the approaches that they have in the observatory. We also have time with the mapping. Some conform, some not, that work in topics of migration. And this is relevant for all of us. And if you have in mind something, well, we will be very pleased if you write it to technical assistance, and we'll talk about and grounding the collaboration. This is so thrilling and very enriching for the observatory. Another question back there, please. Or suggestion? We are talking about a more national situation. We are the system of security, but the state security system. And this part is invisible. We don't talk about it. There's not a lot of information. And we have two qualities. Those of us that offer Social Security but also health, and all of those that publicly are in Social Security, but that health is derived and visualized to the ISTE. And also, maybe we could see that in this indication, in some state institutions, we are not integrating with you in order to have this opportunity to be able to know a little bit more and to take again some things that could benefit us, like tech. This would be the petition for all of you. And I'm going to tour outside of this observatory. First of all, I'd like to mention it's a very important concern, particularly for the countries with federal structures like Mexico, Argentina, Brazil, and all this part in Canada. This part of the subnational units. And I want to highlight the work developed by Professor Carlos Contreras and his team that gave way to systematize the regimes of Mexico in first moment, and that we're looking at the way of putting at the availability of the membership and the public in general, and they distinguish who have this service rendering and many other topics which are very innovative on the one hand, and on the other hand, the topic of information that may be generated in the state institutes. In the year 2020, we launched a first stage of a project that is called Homologated System of Indicators in Social Security, where we, particularly the team led by Professor Krishna, launched information for the institutions of our membership. And at that moment, I think that Guanajuato answered. And in the next stage, we are planning to get information of all the institutions that conform our membership. Maybe you have heard about these institutions and we want to see it in the next future. Thank you. Okay, thank you very much. Any other questions, suggestions, complaints? None? Okay, I have a question, but we have a lot of observatories of Social Security. Obviously, Ingrid talked about them. And just to know how they complete themselves, how they relate themselves. I know that this observatory, maybe it's a little bit difficult, but we need to talk about this. Well, first of all, the emphasis in the interest populations. Many of the mapping that we did, we saw that mainly they are indicators produced at the level of the government, official data. So there's not a lot of information disaggregated by this kind of interest policies. In the Social Security institutions, there are not so many data. We think it's a value added, and in the part of the panel, we think that it's very important to do collaboration agreements with these other observatories that exist in order to see in what way we can share the information in a more adequate fashion. Not only maybe to use the information to be in the platform, but also to construct other indicators that may be useful or relevant. So the value added would be with this observatory, and first of all, I would like to see this focus in the universalization. And the interest populations, that they are data that is very difficult to compile. So going back to this part of quantity, it's very important in order to have information about these access barriers. Thank you so much, Ingrid. Anyone else? I think it's a topic that is not closed, and thank you so much for your attendance and for your participation. If you want to ask something. So mainly is for the membership. The membership will participate. It's going to be better. And we're going to be looking for Uruguay, Colombia, and ANSES that they have at least until now, the observatories that they have talked about. And I think that with this, we will close our panel so we can go eat. And thank you, Ingrid, Miguel, and all the people that are here at the auditorium. And the ones that are looking at us in the transmission in the social media, we thank you so, so much. I know, before you leave at 3 p.m., we start with panel 5 about care system. Please don't miss it. It's going to be great. Thank you so much.